And welcome to Healthcare Sucks! Hey guys, glad to see you here tonight. Thank you for tuning in. You're my favorite people. You're all my favorite. For real. We're bestest buddies. Because you know what? We're lifelong buddies. We're trying to help each other live another day in a very dangerous time, my friends. So, not to be gloom and doom again, but being healthcare sucks, I have to bring you the truth. Just on your own when you're out there surfing, I know you're seeing stuff and it's just out of control, guys. So we'll talk some more later. I'm going to put the film on and let you just kind of watch some. But we're going to start with this person in Canada. You know, the good people and the real people that have a heart that are trying to tell some of the truth are breaking down. They're losing it, guys. The ones that aren't listening, the bigger liars, and the ones that can cover up the truth, they're not going to look like this lady. But when you're listen to what she has to say, and then we'll backtrack and you can listen to the whole thing. Here we go.
Is clear.
Particularly if you have people in your gathering who are elderly, who are more excuse me.
Just take a moment. It's okay.
I went through SARS. I've been through Ebola. I've been through the pandemic in 2009. And I just know how stressful it is for our healthcare system, for my colleagues, and for families.
And with the outbreak widening in this country, it would seem that stress is only going to get worse. Mike Lecouteur, Global News.
As Mike reported, 2 of the cases in BC are linked to a previous voyage on the Grand Princess cruise ship. On this Saturday night, a seniors' home in BC, the center of an outbreak. Investigating the link between the facility and a healthcare worker infected with the new coronavirus.
We are in an extraordinary situation.
The tough task of tracing where else the worker may have been. Trapped with COVID-19 on a cruise ship.
If you're asking my advice, I say don't go.
The freight warning to avoid this kind of travel. Plus, the call for mandatory paid sick days during the health crisis. An Iranian family seeks refuge in Canada after their son is killed in the Ukrainian Airlines disaster. Aloha! And who is Tulsi Gabbard? How the lone female running in the Democratic race is managing to stay in the spotlight.
Global National with Robin Gill.
Good evening and thank you for joining us. We begin with developing news about the spread of the new coronavirus.
And you might be wondering, why are we watching Canada news? Because the Canada news seems to be right on spot, guys, to what's happening here too. We're just getting the fake news syndrome going in there, lying and covering up stuff. And with that, that's why we're watching this, is because it applies here too, guys. But I will hit some spots, if not on this video, my next video tonight, to try to show where it's popping up now. Like I said, coming to a town or home next to you. It used to be, remember, coming to a theater near you. Well, it is coming to a theater near you if we were all out there going. Which is another thing. We're being told not to go and do things no more, guys. Did you hear? They're going to talk about sick leave pay. You guys did it. I'm proud of you. Some of you made phone calls. You guys and me, and we're doing it. We're getting the attention, it seems to be. Because I guarantee you, there are other people besides just us that have these concerns. Here we go.
British Columbia government confirms an outbreak at a Vancouver area long-term care home for seniors. 2 residents there have tested positive for COVID-19. Tonight we are learning the woman who was the first person in the country to contract the virus through community contact is a healthcare worker at the facility. And that worrisome situation is sitting heavy with the province's chief medical health officer.
At this time, I am asking people to consider having virtual gatherings, to consider not coming together, particularly if you have people in your gathering who are elderly, who are more
That's real, guys. That's real.
The fatigue and the stress are setting in. The 2 patients at the seniors' home are among 6 new cases of COVID-19 confirmed in BC today. That brings the number of confirmed cases in Canada to at least 57. 2 of those BC cases involve recent travel to Iran. The other 2 are people who were previously passengers on the cruise ship that is now quarantined off the coast of San Francisco. We'll have more on that in a moment. But first, here's Mike Couture on the efforts to prevent the virus from spreading among the public.
It's a whole community problem, and you see it in these 3 sets of cases today.
The 6 new BC cases originated in different places across the globe. 2 are people who recently traveled to Iran. 2 were previously passengers on the cruise ship that is now quarantined off the coast of San Francisco. And the last pair are perhaps most concerning as they are elderly patients from a care home in North Vancouver. Now, it's worrisome not only because the mortality rate is higher in older people, but because those 2 are connected to that first community transmission, which is said to be a female employee of the Lynn Valley Care Centre.
Many people who work in care homes work in many other settings as well. So there is an ongoing, very detailed investigation that will be done.
Which will include whether or not the worker got COVID-19 from the Lynn Valley facility or perhaps another place she may work and unknowingly transmitted it to the 2 patients. Now, what is clear, according to health officials, is the need to limit public gatherings or at least keep your distance from others while out and about. They're recommending it for something as simple as religious services or even large sporting events like the Rugby Sevens Championship being held in Vancouver this weekend.
I brought rubber gloves to go to the washroom, and I brought like little wipes and stuff, and I was a little bit concerned because I'm immune suppressed.
The International Ice Hockey Federation has taken it one step further, canceling the Women's World Hockey Championship in Halifax at the end of the month. The tournament will be played in Nova Scotia next year instead. The financial hit is yet to be calculated, but the emotional toll of the crisis is clear.
Particularly if you have people in your gathering who are elderly, who are more
Just take a moment. It's okay.
I went through SARS. I've been through Ebola. I've been through the pandemic in 2009. And I just know how stressful it is for our healthcare system, for my colleagues, and for families.
And with the outbreak widening in this country, it would seem that stress is only going to get worse. Mike Couture, Global News.
As Mike reported, 2 of the cases in BC are linked to a previous voyage on the Grand Princess cruise ship. That boat is anchored off the coast of San Francisco with 3,500 passengers and crew on board, including 237 Canadians. At least 21 people on the ship have tested positive for COVID-19. That's on top of the rising number of cases across the U.S., including a popular destination for Canadians this time of year, Florida. 2 people have now died in that state. As Abigail Beeman reports, the number of test kits being made available to Americans isn't keeping up with the demand.
Minutes after passengers on board the Grand Princess learned 21 people tested positive for COVID-19, Global News spoke to Canadians John and Assunta Garrettson.
We feel fine, and I guess I'm just concerned now about what's going to happen.
The former Ontario cabinet minister and his wife were set to fly back to Canada Saturday. That plan sidelined.
We've just been basically put into a lockdown situation to stay in our staterooms, and they're providing us with our meals and entertainment.
You have people that are sick.
U.S. President Donald Trump weighed in on the 3,500 people floating off the coast of California, including 237 Canadians.
Leave everybody on the ship for a period of time.
but said he'd ultimately let the experts decide, as BC's health minister issued the sternest warning about traveling on cruises from a Canadian official yet.
If you're asking my advice, I say don't go.
U.S. Vice President...
Real quick, guys. That's for real. That lady, that's for real news there, man. And this is what's going to do to people. People are going to crack up. People are going to lose it. People are afraid. That's why I'm coming to you. I'm trying to make you guys feel like it's going to be okay. We can get through this if we work as a team and we get prepared and we take all the precautions. Excuse me. Yeah, of course I'm eating again. It's my dinner time. But I dedicate myself to you guys. Because I love you. And I want us all to survive this. We're a team. Yeah. Go team. I am not happy with the way the United States has been tamping it down. Florida, as you heard, has got outbreak. I myself and several tubers covered Florida hiding it. Now it's out of the bag. Okay? They're doing this because, like I told you, the stock market's not going to handle this. It's going to be very bad. It already is. It's going to get worse. And then the WHO bozos, like I told you, they've got those virus bonds that they pay out in June. And so World Bank is backing everybody. I mean, this thing, the cover up and the lights to make money now is making me disgusted. And I'm very unhappy about it, guys. And you should be too. Making money off of people's betting on death and life. I guess they probably do that anyway, but this is really betting on life and death. And then when they should be calling the pandemic, because we could be saving lives, they would have to release monies, and we could be doing things and pushing. Let's go to the next step. I think pretty much so everybody but the WHO, and it's all for the money now, and World Bank has already declared, I'm going to declare pandemic. Right now, pandemic, guys. And as always, I'm supposed to say this, Fair Use Act. We use Fair Use Act so I can share with you guys. And I'm supposed to say this too. Everything you see here is fiction. That lady crying was fiction. The president you seen a minute ago was fiction. So now we got that out of the way, guys. I can't tell you what to do or how to act or what. Nobody can tell anybody what to do, period. Well, it used to be that way when we had more freedoms. But let's just say I can give you the advice. I can help you with going out there and finding things. I can help together as a team. We can make these calls to get the funds set up so everybody's covered once you enter quarantine. If you go back and watch my videos way back, you could sit for a whole night and just do healthcare sucks. And you can watch where this thing creeped. And you can watch for the motives behind it. Because I think I've covered the motives in the last 2 weeks. Where we're at with this and what's really going on. And I'm not paranoid schizophrenic, guys. If anybody, the people that know me, I am the most grounded person you're ever going to meet. Literally. Before I throw out something to you guys, I try to back it up. I try to tell you where to go to verify. I actually ask you to go out and check it out for yourselves. And so I do the running and the work so you don't have to. So with that, I love you guys. Let's watch some more.
And Mike Pence, tasked with dealing with the outbreak, is in Florida to meet with cruise ship executives.
At the present moment, we've distributed more than 1 million tests.
That state saw its first deaths from the virus, the first outside the West Coast.
This administration is now scrambling to try to make up for a very slow start, to reckon with how fast this illness would spread.
New York declared a state of emergency with yet another spike in cases. The governor urging anyone placed on a voluntary quarantine to adhere to it.
Violating those rules is, first, I think, disrespectful to members of the community. It doesn't honor your responsibility as a citizen. And you can be putting people in danger.
Cancellations.
Now, whether you like him or not, he's covering it up too. Again, It's not just the left, it's the right. Both of these people, no matter what team you're on, as far as this political garbage goes, that's why you're Team 99. Hey, maybe that's what... Team 99. I like it, guys. Let me know if you like it. I think I'm going to go with that. We were looking for a jargon, a logo. Team 99. Team 99. Oh, sorry. I got carried away. But it's the left and the right. Did you hear him say, stay there because you're going to endanger people and you're going to blah, blah, blah? Did he say, we want you to stay there and we're going to provide, funds and things so that you can stay there, and we're going to postpone your debts so that you don't get a bad credit rating and lose your home, your car, and everything that you've been paying for in the last 20 years. Or if you're a renter, so you don't get kicked out and become homeless. There's a lot of that going on, we all know. So again, it's not just the right, it's the left and the right. That's what I'm trying to get to you guys. If nothing else, by this thing of, people fighting with each other, is we're the ones being asked to quarantine. We're not the 1% that can afford to quarantine. They can afford to lock their doors right now for a year or two. Literally, and still have things delivered to the house and probably have a chef come in and cook for them. And probably can afford to do that for the year or two. I'm not kidding. This is true, guys. So again, I urge you guys to make calls like we have been. Apparently some of us are reaching, because I'm starting to hear little bits, but I'm not hearing what I want to hear. That they're going to cover, they're going to postpone debts, we're going to be okay. And when we decide to quarantine, whether it's self-quarantine or mandatory, we are covered. And then when time comes and you can go back to work, that there's guarantee that you have a job to go back to. Unless that company's just gone because of this thing, which could be. So with that, back to this.
Keep rolling in, including music festivals such as Texas's South by Southwest. The University of Washington and Stanford have canceled all in-person classes for the rest of the quarter, and a number of businesses are asking employees to stay home, including tech giants on the West Coast. Abigail Beeman, Global News, Washington.
We're watching two other cruise ships in limbo tonight. Egyptian authorities say a ship with over 150 tourists on the Nile River has been quarantined after 45 people tested positive for COVID-19. There are no Canadians on board. And Malaysia has turned away a cruise ship carrying 2,000 passengers. The Costa Fortuna was also denied port at a popular Thai resort because of the presence of 64 Italians on board. If you do show symptoms after returning home from abroad or have been in contact with someone who may have been exposed, Health Canada has specific guidelines it wants you to follow. You should isolate yourself immediately. Call ahead to a health professional or public health authority for advice on what to do. Be ready to describe your symptoms and travel history. Health authorities are also asking anyone who's sick to stay home from work, but not all employers provide sick benefits. That puts workers in a tough spot when faced with losing pay. As Ross Lord reports, there are calls for new measures to protect employees who are ill and the people they work with.
Taking sick days isn't easy for Kim Stewart. She's a real estate agent. Face-to-face contact with customers is crucial, even when she's not feeling well.
And I've gone out there wrapped up in a scarf. I've said, don't touch me. I've tried not to touch door handles with my hands or anything, and I've been out there working while I was ill.
The last thing she'd ever want to do is spread a deadly virus, but it's tough to follow health authorities' advice and stay home if she develops flu-like symptoms that could turn out to be COVID-19. Many others face a similar predicament because taking a sick day means losing salary.
Our entire livelihood is based upon our ability to work. So, if we can't get to work, then we can't pay rent. We don't get paid if we're sick.
Concerns are growing across Canada that choosing between getting paid and going into isolation
could
allow
guys.
the virus to spread. BC Premier John Horgan is urging employers to be generous with sick time.
If they don't have sick leave benefits for their employees in these circumstances, I think they might want to consider that as a solid investment in not just their employees, but their business.
In Nova Scotia and in Ontario, there are also calls for mandatory paid sick days. The Nova Scotia government says it will consider removing a requirement for doctor's notes, at least for government workers.
Even if for the short term that we actually suspend that practice.
Some small businesses disagree.
There are other employers that look at it from saying, I need some controls on whether people are going to be off sick and making sure that it's a legitimate illness.
Tough decisions are looming. Health authorities expect the coronavirus responsible for COVID-19 to spread even to areas like Atlantic Canada that currently don't have any cases. If and when it does, it could put Kim Stewart and many others in an unenviable position. Ross Lord, Global News, Halifax.
Italy's government is putting Milan and several regions nearby into lockdown in a bid to contain the outbreak. Starting today, nobody can enter or exit those areas. The Pope canceled all public appearances going forward and will instead stream services on the internet. Also today, the leader of Italy's Democratic Party confirmed he has COVID-19 via Facebook. There has been a big jump in cases in Italy, which continues to record the highest deaths per day in the world.
But the Pope can afford to stay home. The Pope can afford to do things online. The Pope is covered. Are we? You heard what they said. And then the employers are like, well, we need to know they're not playing hooky. You know, even if they were playing hooky in a time like this, I think personal leave is due. And I think let's just forget the employer's part. That they're dancing around. It's time for the feds. Mr. President, this is to you. Governor Little Brain Kate in Oregon, Senator Wyden, that don't answer their phones. You guys go back and listen. I've tried to call these people. All of them. Get the little checkbook out. Let's issue cards. Let's call the banks. Tell them to postpone those debts. I'm telling you guys, it's got to happen. If it don't, and we keep going down this road, we're looking at 12 Monkeys. And if you don't know what 12 Monkeys is, it's a really weird movie. Just hit the highlights. Go to YouTube and do highlights of this and this and this, and then skip to the end, and you'll see what I'm talking about. But we're at the end of the movie. We're at the part where the virus has already got away. They've already snuck it out. They're spreading it. And bottom line, it's rampant. There's several other movies that are like that. You've seen them, guys. Period. You know, even The Happening was about nature too, and it. Hell, nature's happy. Over in China, they've got the cleanest air they've had in decades right now. You think the plants and the animals aren't loving it over there if they're not sick? Just a thought. Back to the story.
Italy's Civil Protection Agency confirms another 36 people died in just 24 hours, and another 1,000 people were infected. Numbers have spiked.
Sorry, guys. Did you hear the numbers? In 24 hours. 1,000 more. 1,000 more have got it, guys. 1,000 more. That's just Italy in that little area. And how many deaths? Like 50 almost? I've been trying to reach out to the government and other people to get them on the ball for this. I mean, you guys are on it. I hear you. You know, my friends, my neighbors, you're my friends and neighbors too, guys. Literally. You're part of the team now. We're all part of the team. And team survival is what we're doing right now. It's no longer a joke, guys. I'm not doing fear porn. I'm not going to get rich. I'm not making money off this YouTube thing. As a matter of fact, what I did is I said, and it's hillbilly, guys. Look, this is me. You could send me a card and say, thank you, healthcare. You could send me a shirt and I'll wear it because I love t-shirts. You can send me a hat and I'll wear that. But the bottom line is, See this? It don't matter, guys. I don't care. That's why I'm not monetized at this point. Down the road, the only reason for me to get monetized is because I can hit more people. It's not about them. I could care less. I'd rather, again, I said this in my other videos. Instead of giving me a hat or even spending 44 cents on a stamp, take it, go buy something. I was at Canned Food Warehouse last night, grocery outlets and stuff. They've got rice for $1.29 for a big old bag. They've got pastas, 3 for $1 in these little packages. I mean, literally, take a few dollars. If you were going to really buy me a cool shirt, yeah, it'd be cool and I will wear it. But rather than that, I'd rather you guys go buy yourself some stuff. Literally. Again, I'm not doing this for that. And, you know, I pray that you guys will all be okay. Really. And it's just, I'm starting to worry for us all that pretty soon it's going to be like, I don't know if I shared this or not, but I'll share it real fast. So I'm at Safeway. I'm halfway down the aisle, and this girl just starts coughing, and literally all over the soups of all the areas over the soup. And I just said, you know what? And then she starts sneezing. I pulled a 180, went back down that aisle. The problem is, it wasn't just on the soups that people are going to touch and get if she has it. Or even if she's got a regular flu, they're going to touch and get it. She should have been covering with some kind of hanky thing instead of blowing it all over the place. And with it being airborne, if it was the Wuhan 19, it could have went 2 or 3 aisles this way or 2 or 3 aisles that way. So even though I flipped a 180 and went up a couple aisles and went down, you know, what do? And you know, I was there to buy some soup too, but I didn't buy any after that. But it's my point is what we don't know too. Like, how many hundred people went down that aisle in the last couple days after that? How many people bought a can of soup that was spit on, or spitty ones, as we call it at Healthcare Sucks? That's what I'm trying to get everybody to understand. It's what we don't know and don't see that's going to get us. And this is not paranoia talk. And I want to touch on something else real quick, because I do healthcare and I've done mentally ill stuff, helping people for time too. So if you're sitting there and you do have some issues, you know, it's just what we call it. I try not to candy coat, but let's just say, you know, anxieties, bipolars, the cleaning things. I can't think of it right now. Okay, if you have any of that or others, there's so many out there. Don't be afraid, guys. Listen to my voice for 1 minute, okay? The reason you watch Healthcare Sucks is so that you know what's going on. Then you don't have to be afraid of what is not going on. So when you go out and you do go shopping and do all this stuff, if you're really worried, you can wear the mask to try to prevent it. If you're really worried beyond that, you can wear some glasses, at least sunglasses or something like that. A little bit's better than none. You can buy those gloves. They're cheap. A dollar store, they still had some stuff, guys. And I showed you the spritzer. When you get your stuff home, if you can't find those wipes, you take alcohol, get you a little spritzer bottle, spritz on your, see that? And wipe it down. Wipe it down. Here we go. A rag. Wipe it down. See that? Look, look, look. Wipe it down. Now for ourselves, this is what I do, and I've done for years just because I like the refreshingness. This is wintergreen alcohol. You would hope that would at least clean, but if you know. But let's say you just went and bought moon pies. Yes, I'm guilty. I have a moon pie every once in a while. Okay, I just bought these moon pies, and I got them home, and I'm not sure, but I don't have no wipes. Look. Do, 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 do. Do, 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 do. And then, you know, you're probably okay. And then if you're really worried, you can open this up, pour them out. You know, and if you're worried beyond that, you can get those Ziploc baggies, pour them in Ziploc baggies, throw this thing away. And then when you've been out shopping, I've started doing this, guys. You know, these are the things I want to share because I want you to be okay. Now, when I come home the last week, I've started, you take your clothes off at the door, just like you went out and played in the snow or the mud or whatever. You take your shoes off, you take your clothes off at the doorstep, and hey, you have a bag there to put them in. And then you take them right in, put them in the washing machine, jump in the shower, wash off real quick. At least you're trying. What I'm saying is you're trying. Nothing is going to be 100%. But if we try and we work together and share your ideas, you're going to come up with stuff. And I read it and then I try to share with the people, you know, to help. That way you're helping people too. And then if you really want to and you're able, start your own channel, guys. It's not that hard. I mean, just be like me. You know what? I'm part of the healthcare team. You know? And I can do it. Think I can do it. Think that too. I can do it with the spray. I can do it with wiping down stuff. I can do it with telling people, making them aware without making them so afraid, because that's not what we're about. We're here to just teach and then explain that reason we're teaching and telling you so that you don't get afraid, because in the future, in the next week or two, that TV is going to become a scary thing to turn on, guys. It is daily. I put out these daily and it just amazes me. And Dr. John Campbell, you can go check his channel out. If you want to get some from an ex-doctor, I kind of feel, I've been watching him since he started day one. He has some highlights and some things to go by. I don't agree with him 100%. I don't agree with hardly anybody 100%. But I would give him a strong 75% that the guy's got some good advice. So with that, I think we'll tip out of here and we'll start another video off of this. And I just want to tell you guys, brothers and sisters, I love you. And if you do have a condition or just you're worried, I mean, just an average person would be worried in this time. I mean, with the lies going on and us not knowing and then tamping it down. Oh, it's just going to be okay because we want the stock market to stay up. The stock market's done. If you're a stock market person, you can roll the dice and stay in. This is from professionals. Roll the dice, stay in. Just you're going to have to stay in and push through it. If you're going to lose too much. That's the bottom line. It's like going to the casino. You just roll the dice.